Hello everyone, I am Dr. Parvez. Today I am going to discuss about the treatment of cough. What is the cough? Cough is a protective reflex that used for removal of mucus or foreign particle from the air passage. Okay, now cough is a two types. First one is called productive cough. Second one is a non-productive cough. Okay, non-productive cough is also called dry cough. Okay, now first we have discussed about the treatment of productive cough. Generally we have used expectorant. Okay, now expectorant is a two types. First one is a mucus secretion enhancer. Okay, examples are potassium iodide, but potassium iodide nowadays not used because it interfere with the thyroid function. Now next one, potassium citrate. Next one, guanafacin. Next one, tolu balsam. Next one is ammonium chloride, most important. Okay, so these all are the examples of expectorant which enhance the mucus secretion. Now the next one, second part of expectorant is called mucolytics. Mucolytics. It is clear from the name. Mucolytics means lyses the mucus. Okay, basically mucus is made up of mucopolysaccharide. So these are drugs, mucolytics, which break down the mucus and also release the lysosomal enzyme. Now examples of mucolytics are, first one, ambroxol, bromhexine. Next one, acetylcysteine. Okay, so these are the example of mucolytics. Generally, these all drugs are we have used for the treatment of productive cough. Now second part is the treatment of dry cough. Now the drug we have used in the treatment of dry cough is called antitussive. Now antitussive is a different types. First one is opioid antitussive, opioids. Okay, now examples of opioids antitussives are, first one, codeine, most important, but codeine we have not used in the children and those patients which have a low respiratory reserve. Now next one, fulcodine. These are the example of opioid antitussive. Okay, now next one, non-opioid antitussive. Okay, second one is a non-opioid antitussive. Examples are dextromethorphan, most important. Okay, now next one, noscapine. So these all are the example of antitussive. Now antihistamine also you have used in case of dry cough as well as productive cough, especially first generation antihistamine, that is H1 antihistamine generally we have used. Okay. Example, chlorpheniramine, diphenhydramine, promethazine like drugs. Okay. Now another one, demulcent. Demulcent we have used especially in a dry cough, especially those dry cough which are arise from throat, like lozenges, glycerin. So these are the complete discussion of treatment of cough. Thank you all of you.